Hey, everybody. Now, if somebody told you to stop eating something that is essential for the repair and replacement of billions of cells in your body every day, and if they told you to stop eating it for 30 days before surgery, would you do it? This is what we're in here for today. This is Truth or Trend. This is where we separate fear from fact, right? Something that has been repeated too many times that has started to sound like the truth, but we have to start questioning those truths. And we couldn't have a bigger, better, fatter topic than fat today. Fat has been demonized for far too long. I always want to share the opportunity to show people that even the New York Times back in 2016 helped us understand that we have to start questioning authorities that tell us to stop eating essential nutrients like fat. And if any of you have not seen this article yet, this was back in the 60s. There were 3 scientists who were paid off to blame fat and let sugar be fine. And so now we all know that we're slowly figuring out that that was absolutely wrong. And that's the thing about science, is it's a little slow. And we have today with
Bribable.
us 2 brilliant clinicians who are able to figure things out before having to wait 35 years for the FDA to agree with them, so they can bring truth to you. We have dueling authors today. We've got 2 guys who've just written these beautiful books. Dr. Jeff Crippen is going to take us through some deep science and help really eliminate all your fear around this information that may have been told to you, well-intentioned, by an authority figure in medicine who didn't maybe do all of their homework. So we did our homework for you to help you understand that when it comes to essential nutrients, you should start questioning the advice you get from everybody and make sure that you're getting your body what it needs. Dr. Crippen is an essential foundational member of our mastermind group. So he has a real treat for you guys today in a presentation. But before we let Dr. Crippen wow you with all the treat of science, Dr. V, let's help people understand if they're looking for whether or not they need a fish oil, or if they're having enough fat. You've written papers about this. You've got all kinds of great ways for them to kind of tune into their body. Can you give them some ideas? Because I test everybody. The very first thing I do is I do a little blood test to see where their omega-3s are, because in my experience, everybody has like less than half the minimum of what they need. See, so what should they be looking for? What should the viewers know to help them understand if they need to have more fat?
Yeah. So some of the physical signs are, you alluded to a paper I wrote back in the 90s, believe it or not, about when they're deficient in good fats. It's called upper cross syndrome, where the lower trap muscles excuse me, get weak. So the shoulders start to slouch. Then they get the tension in the upper traps. How many people have that, right? And that's an overt physical sign of chronic deficiency of omega-3s, is that bilateral upper trap tension. They're like, it's been a long day. I'm sitting at my desk too long, is what we hear typically, right?
Yeah.
And then as that progresses, the gallbladder gets compromised and congested. So that causes T4, right between the shoulder blades, to go anterior, causes the curve of the thoracic spine to be compromised, and that sets up that Dowlinger's hump. Think Hunchback in Notre Dame, right? That's a sign of fatty acid imbalance. Either typically it's not enough omega-3s, or even potentially too many omega-6s. Seed oils is probably going to be another truth or trend topic.
Is it also something called kyphus, or is that different, right? When people have that.
Kyphosis is the normal rounding of the back, but they lose part of that where it actually goes towards the chest instead of all smoothly flowing backwards,
Okay.
with the fatty acid imbalance, or simply eating too many trans fats. So we've got that, that overt physical sign of it. So that's that tension in the neck and the shoulders and so on. So eating too many trans fats, which disrupt where we bond and where we have the good omega-3s to make hormones and keep the body functioning. And you talked about blood tests. If cholesterol is low, that's fairly well known. Even, that's somewhat truth in the literature, right?
Yeah.
That omega-3s are the building blocks for hormones. So often if cholesterol, we talked about this on the other podcast, but if cholesterol is high, often that's a sign that there's hormone deficiency. So the body's trying to produce the cholesterol to compensate for the hormones. So that's one of the ways eating omega-3s can give a person the building blocks for those hormones. Another less known pearl on the omega-3s is the omega-3s are that cell lipid bilayer on the cells, and that is kind of the protective mechanism to help keep viruses out of the cells. So another omega-3 deficiency is a weak immune system where the body's more pervious. Instead we want to be impervious to viruses and to viruses penetrating. So taking the omega-3s gives us a good healthy cellular bilayer, lipid bilayer to keep proper nutrients going in and out of the cells, but also keep viruses out. So those are some physical signs and symptoms. Certainly then the omega-3, omega-6 ratios, if we're deficient in omega-3s, and that potentially leads to constipation because omega-6s tend to slow. It's called the ileal brake, where the omega-6s slow the flow of feces, if you will, through the colon, causes the valves to kind of slow to close. My favorite story, we were on a trip last summer in Italy, and 50 of us on a bus, and we get from the back of the bus, "Stop the bus, stop the bus." And this guy, something he ate did not work so well for him.
No.
And we're 20 minutes from the closest rest stop, and so the guy's trying to squeeze the cheeks, and so then he asked me, "Hey, what can I do about this?" And I said, well, the last place we were at, they had bowls of walnuts there. It was, and Mediterranean diet, and so had him eat a bunch of walnuts, the omega-6s, to actually slow the flow, and that was enough to get him back on track, so we didn't have to stop the bus on the next trip.
Nice, nice.
So that's how
So
we can use those ratios to modulate, the rate of elimination as well. Go
to
ahead.
break it down now for the layperson out there. So tension up in the neck, right, in the back and in the
Uh-huh.
middle would
Uh-huh.
be a sign. And we have a lot of chiropractors that watch us too. So the upper
Right.
cross syndrome you said is something that
Yes.
maybe is a ping to say, hey, check in whether or not they're getting enough omega-3s in their life as well. Okay,
Right. Right.
cool.
Hmm.
Very cool.
Yeah, and then similarly, that Dowager's hump, where they start getting the hunchback, that's where that kyphosis you talked about becomes concave just below that at T4, kind of between the shoulder blades. So then there's that hyperkyphosis that is that hump in the back. That is a fat metabolism problem as well.
So not necessarily just they're not getting enough fats, but they may not being able to digest the fats would be a piece of that,
Right.
right? Which is a
Right.
whole other
Right.
conversation. We can get into. Okay.
Yes. So those are some of the physical aches and pains. If they're deficient in good fats, we're gonna have blood sugar issues. They can set up carpal tunnel syndrome. That's a massive subject in and of itself. But if you have some of these multiple signs, headache wise, the hormone deficiency is going to potentially set up. Well, estrogen, that's estrogen dominant. It's a little bit different, the temporal headache, but the thyroid headache is more likely if we have low cholesterol, if we're deficient in those good hormones, then that can cause that tension headache in the back of the head.
Nice, nice. Okay, but they should definitely stop taking any fish oils 30 days before surgery, right?
Controversial boy, you.
Well, this is what we heard, and that's what was Dr. Crippen was just telling us about how he's heard this from so many people. So, Dr. Crippen, help us stop the madness here. Tell us what's going on.
So for about the first 10 years of practice, I just it never seemed right to me, but I never took the time to deep dive it like I wanted to. And then, it got to the point where within like a few weeks to a month, I had a couple patients going in for procedures, and one of them, their doctor told them to avoid fish oils for 3 days. Another one told them to avoid fish oils for a week. And the third one, as you referenced, told them to avoid fish oils for a month. And I said, this is bananas, right? This is just like, we're just like making stuff up here, right? So what's the actual truth of it? Not the trend. And that prompted me to go through this because, when you're in practice, there's every once in a while you have a patient go in for a procedure and you add it up over weeks. And it says like, at some point it's gonna be worth my time to deep dive this and then do it once. And then I just want to send this podcast to them every time that happens. So I don't have to go through a presentation. So anyway, that's where this started with just frustration of this can't be right to, okay, let's actually see what the science says or where this comes from. And that's kind of what I'm presenting to you guys for the first time.
Love it. Absolutely.
All right, so I'm gonna jump over and share my screen here, and we will get into it. Truth or trend?
And this gives people permission, Dr. Crippen, to question a lot of advice that they're given, right? That's the purpose of this. This is a big one. And
Yeah.
for those of you who have questions or you're getting advice that doesn't feel right to you, doesn't make sense, like we've just talked about, Put it in the comments. Let us know, and we'll do something. We'll do another one about this. But I'm so excited. Look at this beautiful presentation. I love it.
There we go. April 21st. Here we are. So, where did this come from? So, just a quick background. So, we talked about omega-3s. So, EPA and DHA are two of the more common ones found in fish, shellfish, and some algae. They're essential nutrients in various bodily functions, including cardiovascular health, brain health, eye health. Obviously, Dr. V, you were giving us some examples how they impact digestive health. They're actually vitally important for hormonal health. So, anyway, it goes much beyond that, but that's the beginning of it. This is important because fish oil are some of the most commonly used natural supplements. About 19 million American adults are taking them. A study from 2015 referenced 11.8% of Canadians are taking it as well. So, this is something that, occasionally surgeries are getting delayed because of this. Hey, we can't give you this open heart surgery you need right now because you're taking a fish oil. We can't give you this cancer removing surgery because of this, which is making hospital stays longer, more expensive care. And the question is there truth to it? So, and then fish oil has many cardiovascular benefits, blood pressure, lowering blood pressure, triglycerides level, improved endothelial vasodilator function.
Can I jump in with a question here for both of you guys?
Yes. I was just going to say, yeah, go ahead.
Oh, I'm sorry. Go ahead, please.
I was just going to define that. So basically it improves the ability of the arteries to relax and contract, which has a blood pressure lowering effect. Yeah, jump in.
Absolutely. So you talking about how so many people are taking fish oils, right? There's all these Costco fish oils and these over-the-counter fish oils. Well, I'm sure you have people bringing them in, and you guys muscle test for these. How often are you seeing people who are taking fish oils that they're getting from a questionable source? Would you say that you have to say, hey, give this to somebody you don't like, is what I usually tell people when I see a bad fish oil. I mean, are you seeing a fair amount of them? Is what I'm saying. Is that an issue with you guys or not?
There's a fair amount. Remember, fish like tuna carry mercury, so we do want to, make sure that it's quality tested properly. Make sure that is not there. Processing can certainly ruin an oil. That's often also why I like capsules, because it's less prone to oxidize. Because the difference between a good oil and a bad oil is oxidation. Ultimately, that's LDLs or oxidized oils. The bad, and there's low density lipoprotein. The bad cholesterol is an oxidized fat ultimately. And so if those are oxidizing, even like your olive oil, if that's sitting around too long, too open to the air, that's going to oxidize and become a bad fat, which sets up that Dowager's hump, that poor posture, the tension that we talked about, and inflammation. So those are certainly relevant topics, and Dr. Jeff has got something to pounce on with this too, I could tell.
Yeah, no, I think you hit the two key issues. I mean, the two key issues are oxidation of the fats, which is quite simply, if you bite in to the fish oil, does it taste like rancid fish? If it does, that's your sign. I mean, so the two issues are, you hit on it. It's rancidity, because omega-3s are polyunsaturated fatty acids, which means there's multiple places oxygen can hit them, right? And then it's the toxicity issue, which is definitely an issue, especially in larger fish like tuna. So those are the two things, absolutely, that you got to look at there.
Sweet, thanks, guys. Didn't mean to interrupt. Carry on, sir.
No, yeah, no. So that's great. And just one other thing. So some meta-analysis showed omega-3s significantly reduced coronary heart disease mortality, sometimes up to 70 and 90% if you optimize that, including your risk of fatal myocardial infarction and sudden cardiac death, which led the American Heart Association of all people to recommend fish oil supplements to prevent cardiovascular disease in patients with heart disease and prevent hospitalizations in patients with heart failure, reduce ejection fraction. And, in the US, there's a qualified health claim that they lower, triglycerides, high triglyceride levels. So there's those kind of just a kind of quick overview of the simple benefits, really cardiovascular focused of them. But the point is, a lot of people are taking them. There's a quality issue, as you brought up, Dustin. And what do we do about when we need to go into surgery? Right. So
let's just take a second to describe triglycerides. We've used that term several times, so some people may be unfamiliar with what triglycerides are.
Yes. So the way I describe them simply to patients is just blood fats, right? And this is part of your standard lipid panel. Your typical reference range is going to be 0 to 149, or under 150 is what they're going to want for normal. But it's basically fats in the blood. And paradoxically, if the number is high, it has little to do with fat, right? Most often it has to do with what Dustin showed earlier, which is elevated sugar, carbohydrate, especially refined carbohydrate consumption. And, you know, tell patient, under 150 is lab normal, right? Probably, but optimal is going to be lower than that. Kind of the number I use is somewhere between about 70 to 100. I'm not married to that range, but the point is you can have fats that are too low, right? If we're not getting enough good fats, we want to be aware of that. And generally we want it significantly lower than that 150 number.
Yeah.
So basically blood fats is what I think. What do you look at it as, Dr. V?
I just say think of them like cellulite. I mean, triglycerides are basically the body storing sugar for, carbs for winter. And so think of the cellulite hanging off the body. That's basically triglycerides. That gets people's attention.
It's a great visual.
And I think the hard truth for a lot of people, I find when the triglycerides are really high, is it's a clear indicator they're not getting enough exercise, almost always in my experience. So that would be the first thing I would help to encourage them to. And of course, like you just said, Dr. Crippen, getting the sugar low as possible is going to be the two things you have to do if they're too high.
Yeah, absolutely. Because the more that sugar you burn, right, through exercise, which is kind of your point there. Yeah, there's two ways to handle that, right? Consume less of it, burn more of it, or ideally both, right? Which would be a great combination. Yeah. Which is
a little bit of a rabbit trail, but the cardiovascular exercise raises the HDLs, the good protective cholesterol. Back in earlier days when I was doing predominantly anaerobic training, all the bodybuilding routine, I traditionally had low HDLs, believe it or not, and I was doing no cardio, and 2 hours a day of high intensity to fatigue to exhaustion weight training, and my HDLs consistently came up bad, and I was eating a non-fat diet. My typical diet was being evaluated at less than 10%. That back in the when the trend was low fat diet, people would bow every time my diet would be evaluated. Wow, 5,000 calories, less than 10% from fat. How do you do it? What a stud, And my HDLs were low, and I was hypoglycemic, falling asleep every time I stopped, and but yet everybody was bowing, thinking that I was the trend,
Yeah.
All right.
Yeah. So that takes us. So we're back here. So then the question is, because where does this concern come from? Because we hear it all the time, right? Whether it's 3 days or a week or a month or whatever it is, it's get off your fish oil before surgery almost every time, or at least that's what's happening in my class, almost every time without fail. So I was curious, so where did this come from? Before we can evaluate if it's true or not, I want to understand where it started from. So theoretical concern with the idea that EPA and DHA, which are two of the more common types of omega-3s, may compete with arachidonic acid. Basically, this gets a little technical, but the bottom line is it could reduce platelet activation and aggregation. So it could stop the platelets from clotting together, which is a good thing all of the time, except, when surgery, you need your platelets to work. So the authors of this study, and I'll show you the study in just a second, right? Yet little or no objective clinical evidence supports this practice. The risk remains largely theoretical. And this journal, it's real small at the bottom, and I'll show you bigger in a second. It's from Circulation, Cardiovascular Qualitative Outcomes. It's a journal of the American Heart Association, which I think is significant because if you can find research from the belly of the beast saying what we're saying, it gives a lot of credence to it. So the risk remains largely theoretical because prior clinical trials have not reported significant increased risk of bleeding with fish oil supplementation. It's a theoretical risk. They've never found it in trials.
Wow.
They've had the occasional ones, and I'll go through a couple of them. There's a couple that have, but they haven't been repeated. And there's much more to say the benefits far outweigh the risk, and we'll go through that in a second. So it's a theoretical concern. Where did this theoretical concern come from? This idea that Eskimos who have a higher level of omega-3s in their body, something you can measure through the red blood cells called the omega-3 index, as Dustin alluded to earlier, basically they had a potential bleeding risk they saw with the Inuit or the Eskimos. After these results, several mechanistic studies of EPA and DHA and platelet function suggested diminished platelet aggregation with a variety of proposed molecular mechanisms. So Eskimos have a little they bleed a little bit longer. Their bleeding time was a little longer. And then they say, hey, there's a bunch of theoretical ideas on how this could be true. Okay.
Can
These
we back
raised,
up? Can we simplify
yeah,
that a little bit for people?
yeah, please.
So just to bring it back to a lay understanding, EPA and DHA are the good fats, the ones that we want, right? So DHA is very prominent in protecting against concussions, keeping the brain functioning well. EPA more tends to be with hormonal balancing, and that those are your good omega-3 fats that are in a lot of the fish oils and so on. Ladies, arachidonic acid you're familiar with that's your menstrual cramps. That's the inflammatory type of acids, fatty acids that we don't want, and that's a prostaglandin 2. So again, arachidonic acid, when we get too many seed oils, too many bad oils, arachidonic acid goes up. That means inflammation. Whereas EPA, DHA, that's your omega, that's the main constituents of an omega-3. Those are anti-inflammatory. Those are the ones that you want. So just to kind of help simplify for the lay public, what these things are, what's Dr. Jess referring to in this amazing research. So thank you. Keep going. Let's just sort of try to keep it understandable for people.
Definitely.
Yeah,
Let me just
great.
clarify too, because I know I can hear people saying, "Well, we need some arachidonic acid. Our body, right, has to for it. It's just the fact that we have high levels of it due to the results of our diet, and usually because we're not getting enough EPA DHEA, it's going to be causing that. In fact, when we test the omega-3 index, it does show us the arachidonic acid levels, and the only way, well, the most efficient way I've seen that correct was by adding more omega-3s. Right. Not necessarily removing those, but it was a sign that you needed more omega-3s as well.
Yeah.
And also sugar insulin causes the EPA DHA to shunt through this. It's called delta 5 desaturase, causes it to shunt to arachidonic acid. So that's part of why sugar is inflammatory, right? Is it converts those omega-3s, the good anti-inflammatory oils, into the arachidonic, into the inflammatory oils. So keep your sugars to a minimum. Here we go. Recurring theme. But it's all related, right?
No, that's great because that takes us back to the idea we need to look at the body holistically, right? You can look at one piece, but obviously we don't live in a mechanistic world or a mechanistic body. It's important to look at that holistic viewpoint, like you guys are saying. So anyway, that's great. So we build on all of that, and there's a concern about bleeding risk with fish oil. Right. So led many healthcare providers and organizations to request that patients to stop taking them for a week before surgery. Some days it's 3 days, sometimes it's a month. But the standard practice can therefore delay patient care as well as increase hospital length of stay and cost. Yet, these are the author's words again, these recommendations based on theoretical and mechanistic concerns have not been supported by empirical evaluations of bleeding risk in clinical practice. What does that mean? It said it in a book, but nobody's found it true in life. Right? That's what it said. Or it hasn't been investigated, it hasn't been inspected. So this researcher said, let's take a look at it. So let's look at, there have been a few studies that showed increased clinical bleeding related to fish oil. Just quickly, a gentleman named Clark saw an increased incidence of nosebleeds in children treated for high cholesterol, but this finding could not be reproduced. So it happened in one study, didn't happen in a follow-up. Yokoyama and friends reported higher rate of minor bleeding with EPA, ethyl ester, and a statin versus statin alone in adult Japanese, this probably should be people with hypercholesterolemia. Yet other large trials of fish oil in patients with hypercholesterolemia or at higher cardiovascular risk have not reported the increased bleeding risk. Again, one study showed it, not confirmed in others. And fewer trials, generally up to 700 patients each, have evaluated bleeding risk in fish oil in patients undergoing major surgery with no significant increased risk. Wow. So that's where we are. And that takes us to this study right now. It's a publication of the American Heart Association, the journal Circulation. So what they did is basically they said it's a theoretical concern, let's investigate it. So results, risk of bleeding was not higher in the fish oil group. Nice. So not higher. Total units of blood transfused were significantly lower in the fish oil group compared with the placebo. And here's the kicker, higher levels of blood omega-3 polyunsaturated fatty acids, basically higher omega-3 index, higher amount of omega-3 consumption over the last 3 to 4 months, were associated with a lower risk of bleeding, with substantially lower risk in the third and fourth quartiles compared to the lower quartile. What does that mean? There's a dose-dependent relationship. The higher your omega-3s, the lower your risk of bleeding. right? And that
You say that
basically,
again. You say that again.
ask your doctor if taking something that's vital for your health is right for you, right? Especially before surgery. But what it's saying is the higher your omega-3 consumption over the last 3 to 4 months, the lower your risk of bleeding.
Hmm.
And the higher that number is, the lower your risk of bleeding is in a dose-dependent relationship.
Mic drop.
So, yeah. And that's the end of our podcast today. Please join us next week. So conclusions, fish oil supplementation did not increase perioperative bleeding and reduce the number of blood transfusion. So no increase in bleeding, and the people got less blood. Higher omega-3, anyway, that's one of the technical ways to write it. Omega-3 fatty acid levels were associated with a lower risk of bleeding. These novel findings, this is an exact quote, and it's in purple in this page just so you can see it in the study. These novel findings support the need for reconsideration of current recommendations to stop fish oil or delay procedures before cardiac surgery. So next time your doctor gives you that recommendation, send them a copy of this. Ask them if they've read it. Ask them if they're familiar with it. Because this is 2018 is when this came out. So this is 7 years old. Right? On average, it takes about 17 years to get from the research to your doctor's office. So in 2035, maybe they'll be aware of it, but maybe you can help them kind of shorten that curve right there. But these novel findings support the need for reconsideration of current recommendations to stop fish oil or delay procedures before cardiovascular surgery. So just a little more detail. This was the largest trial they had looked at, 1,500 patients across 3 countries, United States, Argentina, and Italy, largest trial to date. And they used a prescription Lovaza, the prescription EPA and DHA. The loading dose was 10 grams over 3 to 5 days. And it wasn't clear, but I think it's over 3 to 5 days, not 10 grams per day, or 8 grams for 2 days, including, and I highlighted this, 2 grams on the morning of surgery. Right? This is like the last thing the doctors would tell you to do. They gave them 2 grams as they're rolling them into the operating procedure. Right? And post-operative, they did 2 grams a day for 10 days or until discharge.
Wow.
So a little more detail. We said risk of bleeding went down. Specifically, it went down severe to fatal bleeds. There's a way to grade bleeding in surgery. But the worst ones, up to a fatal bleed, went down 19% compared to placebo, which is an absolute risk. Not to confuse it too much, was down 1%. But basically, it was a significant finding both days. Significantly fewer units of blood transfusion, 16% less. And achieved levels of omega-3 fatty acids on the morning of the cardiac surgery were associated with significant lower bleeding, with 70% lower risk in the 3rd quartile and 64% in the 4th quartile. Basically, this is a significant risk. So what did they say? We showed fish oil supplementation did not lead to increased perioperative bleeding across multiple commonly used bleeding definitions. They looked at about 4 or 5 different standards for what defines bleeding. On the contrary, patients randomized to fish oil required fewer units of blood transfusion compared to placebo. The results were similar across patient subgroups, with none showing higher bleeding risk with fish oil and supplementation. So they said, did it depend on country? No. Did it depend on the type of surgery? Because they looked at 3 different cardiovascular, basically heart surgeries. No, it didn't matter. So the study was very clear across the board and just said, hey, this is trend, but not truth.
Mm-hmm.
Dun-na-na-na.
Yeah. I've got a couple more I can go to, or if you guys want to.
Yeah, please. I mean, we need to drive this point home because honestly, Dr. Crippen, here's what happens, right? Is people say this and then it gets poo-pooed by somebody who has some authority in medicine, whether they're a nurse practitioner or a doctor. And so they need to hear this over and over again, and they need to have this in their back pocket so that they have the courage to really stand up and question the authority, right?
I think so. Let's hammer them in the most friendly and persistent way we can.
There you go.
Right. One other study by Walkerson, reduced rate of blood cell transfusion in the fish oil group compared with controls. This is a totally different study. In addition, there's a non-significant lower rate of major bleed and blood volume loss in the fish oil group compared with controls. Del Bruto demonstrated lower rate of cerebral microvascular bleed. Think of bleeding in your head among adults who consume large amount of oily fish, which is the exact opposite of what the theoretical concern would say. concluding that fish oil supplementation may prevent cerebral microbleeds. What do we call that? We call that a stroke, or we call that a TIA, mini stroke, transient ischemic attack. And then they continue, we don't fully know why, although the exact mechanism for this beneficial effect of fish oil in patients undergoing surgery is unknown, previously described platelet-sparing effect of fish oil may potentially play a role. So the idea is that the fish oil may help spare the platelets and help them be able to be reused or used more effectively. That may explain this. And then here they just explain that sometimes, platelets can become deactivated during cardiovascular surgery, and it's not uncommon to use platelet-sparing medications to prevent hemorrhage during cardiopulmonary bypass. What does it mean? Well, instead of giving them a drug, the platelets may be spared by the fish oil instead of needing to take another medication, and that's going to result in less blood loss, less need for transfusion, and overall better outcomes. Another study here, omega-3s in surgery. This is a radical prostatectomy. And I love this from the summary. Despite no clinical evidence, discontinuation is recommended before radical prostatectomy. So they're saying there's no evidence for this, but everyone tells you get off your omega-3s before you have your prostate removed. However, omega-3s appear beneficial against prostate cancer progression. Oh, by the way, they may actually positively slow your prostate cancer progression. So this is important to figure out. Intervention in this case was 3 grams of EPA daily for 4 to 10 weeks prior to the prostate being removed. So we found no clinically significant effect of omega-3 versus placebo on perioperative bleeding, laboratory tests, or postoperative complications. Our results suggest that omega-3 supplements can be taken safely before radical prostatectomy without increased bleeding risk. These findings are relevant since omega-3s may beneficially affect prostate cancer evolution. So not only is it a mistake to take people off because you don't bleed more, but oh, by the way, the omega-3s are stopping the prostate cancer from getting worse. And I've got one more study I'm going to show you after this shows colon cancer, the exact same thing. And actually it slows down it actually have an anti-angiogenic effect in colon cancer, which is really cool. But the point is the omega-3s aren't just helping with the inflammation, with the cardiovascular health, with the heart health, preventing upper cross, helping with digestion, right? Giving us good hormonal support. They're also having an anti-cancer effect in our body.
Well, you just can't replace a cell with a healthy cell without the fat.
Yeah.
You have to have the phospholipid bilayer. And it's so amazing to me that we forget about that. And its essential role in reduction of inflammation or resolution of inflammation. So many times people take all of these anti-inflammatories and they forget that you have to have the fat there to complete that process for it.
Yeah, it's so true. It's like foundational.
Now, let me ask real quick before you finish up with this next one. Oh, this is still the prostatectomy, but when they tell them not to take fish oil, do they tell them not to eat fish? Do you notice?
So that's the question I always ask my patients. So they tell you to not eat fish?
Right.
No? Okay, well then have salmon 4 times a week. That's how I handled it for 10 years.
Yep.
So that was my answer for 10 years was, well, if you can't do that, I usually said, don't fight the doctor. It's not worth it. Omega-3 index is over 90 days, 120 days. So lay off it for a week. That's fine. Make sure you have salmon 3 to 4 times a week that week or something equivalent, and we go on. So that would be the way I would handle it with patients, because I'd ask them that question, and no one has once told me the doctor told me to stay away from fish.
Wow. And the doctor definitely didn't tell him to stop eating sugar in that time.
Yeah, exactly. And the other thing is, if this was true, right, what do we know about omega-3s? Well, they're roughly that omega-3 index you talked about or alluded to. The average omega-3 is about 4% in the US, and in Japan, it's roughly around 8%. So theoretically, to use their favorite word, we should see huge numbers of bleeding post-surgery in Japan, right? We should have these huge surgical outcomes that say this is a problem in Japan. And guess what? Well, no one's ever seen that study, and I haven't either, and I've never heard of it. In fact, Japanese outcomes and health is much better than our own, right? So just on like a first principles basis, it doesn't make sense, right?
These are great questions. It's so good to give people these questions, and it's such a great option. I love that you told them to eat salmon. That way you're not in direct conflict and you're still going to get the best health outcome for yourself without that stress. So great advice.
Yeah.
Yeah.
Yeah. So yeah, go ahead.
No, I was I was just going to get into the theory part. How are you guys bolstering platelet aggregation? That's how we prevent bleed out. Supplementally, what are you using to bolster platelets?
Yeah, great question. If I wanted to do something, typically sesame seed oil would be the number
Yep.
one thing I would go to. And then,
Mhm.
maybe secondarily bone marrow health. If I
Okay.
need to do something a little more about sesame seed oil, either, yeah, from diet or from supplement. How about yourself?
Yeah, so I'm looking at vitamin E is the best thing I
Okay.
see to correct that on labs. So both of us are talking about oils again,
Yep.
right?
Yeah.
Where does omega-3 come, or where does I just let the cat out of the bag? But vitamin E is in nuts and seeds, right? Like your sesame
Yeah.
seed oil. Sesame seed oil is also one of the best things to slow that delta 5 desaturase pathway I was just talking about that
Oh, wow.
causes the omega-3s to become pro-inflammatory. So sesame seed oil slows that negative aspect of too much sugar down. So again, that's going to help prevent the bleed out per se. But again, nuts and seeds. So so the omega-3s, I mean, they're basically the slide you had a couple slides ago kind of probably says what the goal was. It increases hospital stay length and
Right.
duration by taking them off of these.
Right.
Ultimately, that's their goal, right? They're in business.
Mhm.
Yeah. Honestly, that's probably the sad fact of that. There for sure. Yeah.
Well, let's get back to your
Um,
prostates.
yeah. Yeah. So these guys went through it and said, is there any truth to this trend? And they said several earlier studies found no significant increase in bleeding complications during cardiac, abdominal carcinomas, or spinal decompression surgery.
Mm.
No effect, no effect, no effect. Narrative review identified 18 studies where omega-3s were provided to a patient who underwent major vascular surgery or femoral artery puncture and concluded that in all of these studies, the risk for clinically significant bleeding was virtually non-existent.
Wow.
One of the takeaways, and I put in quotes there, the benefit of triglyceride lowering with omega-3 fatty acids more than outweighs the theoretical risk of bleeding. Obviously, we've talked about a tremendous number of benefits beyond just lowering triglycerides, but that's one of the most well-known kind of in the traditional medical community. And the intake of omega-3s could be beneficial in prostate cancer. It's thought to have potent anti-angiogenic effects. We'll get into more of that in a second. What's interesting is I'll pull up the study, but it was outside the US is where this happened. And you know that because the omega-3 index at baseline
Yeah.
was 7.4, right? And after taking it for 4 to 10 weeks, it was 10.4 in the intervention group compared to 7.4. The number we're typically looking for is 8 to 12. So
Yeah.
these were pretty good numbers before. But the punchline, once again, our results suggest omega-3 supplements can be safely taken before radical prostatectomy intervention without increasing the risk of surgical bleeding or postoperative complication. Literature on the subject is scarce, especially considering oncological surgeries for cancer. Oncological. Few studies discussing the theoretical bleeding risk associated with omega-3 intake advise discontinuation before any surgery, and this is highlighted without clear evidence to support this practice. So again, all theory, no fact. And the preponderance of evidence stacks up to say keep taking them.
Yeah. Wow.
Final one here. And
Quick
yeah, go ahead.
question.
Yeah.
You're both doing omega-3 indexes on most of your patients. What you said, it's obviously not in the US. What is the typical omega-3 index in the US?
4%, 3 to 4% is what I see.
Yeah.
Average. Yeah.
Pitiful.
And vegans, usually below 2%. Right?
Whoa.
That's a tough one. That's a real tough one. But yeah.
Yeah. Vegans in the military are two of the stuff that they talk about in the literature is
Hard to keep
lower
the
than
omega.
yeah.
Yeah, it's hard to keep the omega-3s good in an MRE, huh?
Yeah, exactly. That's exactly right. Yeah.
That's
Yeah.
meals ready to eat for all of you civilians out there.
Yeah. And unfortunately, the people who, their health is vital to their job in a real dependent way aren't getting the nutrition that we know would optimize it. Yeah. For a whole variety of reasons.
And the reality is it's processed out of foods because that's the part that goes rancid, right? So they process it out so that it has better shelf life, increases their profit margins, you know.
They kill it so it doesn't have to die, is what you're saying.
There you go. There's a good punchline. I like it. Quotable verse.
So take us home, Dr. Crippen.
Great. Final study. Basically, the punchline is 2 grams of EPA and 1 gram of DPHA per day for 7 days before and after surgery. 140 patients, 125 underwent the surgery and were analyzed. No differences in postoperative complications after surgery. Risk of disease occurrence was 3 years was similar. There was a slight increase in disease risk after 5 years. It was not significantly significant. Here's the interesting thing that this is something I hadn't heard before. There's a synergistic anti-cancer effect between EPA and 2 types of chemotherapy, 5-fluorouracil and oxyplatin, against human colonic cancer cells. So anyway, they talked about it works synergistically with chemotherapy to kill the cancer cells. So another reason why this is especially relevant. Anyway, chemotherapy is a whole nother conversation. But the point is it has an anti-cancer effect that way. No difference between infectious or non-infectious complications, non-significant decrease in length of hospital stay. So the people got out slightly sooner, 1 day earlier. And here's the final slide. A higher intake of omega-3s after colorectal cancer diagnosis was associated with lower risk of mortality from the disease. And here's what blows me away. So if you get diagnosed with colorectal cancer and you start omega-3s the day you get diagnosed, there's a 41% decreased risk of death. And those who took 300 milligrams, 0.3 grams of omega-3 daily, your risk goes down 41%. If you can have a 70% decreased risk of death, and those who increase their marine omega-3 fats by at least 0.15 grams or 150 milligrams per day. So 70% decreased risk of dying just from doing that. And I'll show you the study in a second. Previous phase 2 double-blind, placebo-controlled, randomly controlled trials. Anyway, the good stuff, they gave them when patients with colorectal cancer and liver metastasis received 2 grams of EPA daily or placebo before they had a liver resection, which means they cut it out or cut part of it out. The omega-3 EPA they found was successfully incorporated into the liver. So they saw the EPA made it to the liver, and they saw a trend towards reduced tumor vascularization in the omega-3 treated colorectal liver metastasis was recorded. The authors reported a non-significant trend towards survival. So the big push for chemotherapy drugs, 10, 12 years ago, was anti-angiogenesis, which was the idea that if you could cut off the blood flow to the cancer, it had to die. And what they're saying in this study is they saw omega-3s had that effect.
Wow.
They were having an anti-angiogenic, which means they were cutting off the blood supply. And it's just like if you cut off the blood supply, you can't live. And they were having that effect in cancer cells. So, ladies and gentlemen, that's it.
Yay! Bravo, doctor. Thank you so much. I mean, I know I'll be taking my fish oil today, but I take it every day anyway.
So the 2 grams, most capsules are about 700 to 1,000 milligrams, right? So you guys are probably talking 4 capsules. You doing 2 or 4 capsules on average?
I have an equation when I get my omega-3 index back from people, because I did a small clinical trial on this myself to see how quickly I could correct the numbers and get them above 8. And so depending on how many percentage points they are below the 8%, I give them more for at least the first 30 days. Because I want to get them out of that risk range as quickly as possible and give them all the benefit they can. What I always remind them is that it was Dr. Harris who did the omega-3 index, and he looked at 27,000 people, and he showed a 35% reduction in incidence of fatal heart attacks across that population. Not like risk factors or anything, like the actual incidence of fatal heart attacks was 35% lower if they had omega-3 index over 8%. So to me, I'm like, I need to get every person above 8% as quickly as possible, because the heart is the number one thing that ends the game for everybody. So yeah, if they're at, say they come back with 7%, I'll say, okay, that's 2. I'll give them 2 tuna oil or 2 cod liver oil a day. But if they're at 4% for the first month, they're doing 8, and they're doing it throughout the day, right? Because I just want to get them saturated and I want to get them feeling better as quickly as possible. That's me. What about you,
So,
Doc?
well, so putting that in patient terms, somebody that's at 4 is probably not eating much fish, eating
Right.
sugar. So to help people that are listeners, understand how potentially what the range is, what they should take. So somebody that's eating salmon 4 times a week, say, and good omega-3s, they may be doing 2 a day, whereas somebody's a vegetarian or
Mm,
purely plant-based, not getting any fish, not getting rarely getting the omega-3s outside of flax or chia seed, they're
yeah.
more likely to need 4 to 8 a day. Is that kind of your range from a lifestyle perspective?
Yeah, I mean we have to talk a whole separate talk when it comes to vegans and vegetarians because the amount of time, because I actually did this, the amount of time it took to correct them just from 2 to 4%, I was doing triple to quadruple the amount of vegetarian omega-3s and for twice as much time, and we still only got them to 4%. So it's just not as efficient, right? You
Mm.
the marine version, as Dr. Crippen was talking about. Now, I believe that I haven't done enough with the algae oils yet. I believe that those may be
I
superior.
I I found that works quite well. So you can see the change with the algae oil if which is where the fish get it from. Yeah, versus the walnut or the chia or something like that. It'll be similar to a fish oil type effect is what I found if you're getting it from the algae oil.
Mhm. I tell people, Dr. V, if they can eat fish, good quality, wild caught salmon from the ocean, 5 days a week, they're probably in the good range. That's the easy
Yeah,
Mhm.
yeah,
for everybody, right? If
yeah.
you're doing it 5 days a week, you're probably good.
Mhm.
Yeah, and I think from what I saw of the research, that's kind of what they were saying. It's 4 to 5 times a week. If you're doing 3 to 4, you're probably not there, right?
Right.
It's four
Mhm.
to five, and it's consistently, and obviously it's a 3 to 4 month average. So it's if I think that's kind of the number I would use too as well, Dustin. 5 days a week, you're good. 4 to 5, you're good. Anything under that, you need support, and the amount of support you need depends on, you know whether you have pet fish, whether you've ever looked at a fish, whether you've ever smelled a fish, or whether you're just allergic to fish, or whether you eat it 3 times a week, right?
And
Mhm.
I do caution
Mhm.
people not from tuna too much, right? Because that is the one that you got to be worried about with heavy metals. But because there's a large percentage of people out here who probably have compromised biliary function, meaning they've either lost their gallbladder or their gallbladder's not working so well, that is that you can't just assume that taking the fish is going to get you there. So make sure that you are working with somebody like Dr. V or Dr. Crippen to make sure that your body's ability to digest it is 100%, right? You want to make sure you're getting the value out of it if you're going to take it.
Yeah, the simple thing I tell them on fish is the best ones are abbreviated SMASH. So
Yeah,
salmon, mackerel, anchovy, sardines, and herring. That's kind of the quick, lowest toxicity, healthiest versions of it. Obviously, you know,
absolutely.
the bigger fish, the
And
tuna, you get into some other things.
sardines are mercury-free fish because they eat they eat
Mm,
plants,
Oh,
whereas
nice.
mackerels eat they're omnivores,
Right.
so they're
okay.
prone to have a little bit of mercury. So
Yep. Yep.
sardines are beautiful food for this group.
Yeah.
Just plug your nose if you have
Yeah. I've told so
to.
many people to eat sardines that I did a, sardine surrender offer last month. That all the people who bought them and didn't eat them, they did the first job, but they didn't eat them. But they brought them in, and now I get to eat them. So,
Nice.
but yeah,
I remember the
sardines
qu-
are gold. Yeah, there's a lot
the
in there.
line the line always think of is from Bruce Bond. He says, "Just because you don't like it doesn't mean you don't need it."
That's right.
Right,
Yeah,
and that's like
Nice.
the one I think about some of the foods.
Mhm.
definitely. But, oh man, Dr. Crippen, thank you so much. I mean, I'm so grateful because this is going to be so helpful for so many people. I already know several people I'm going to send this video to who are going into surgery and who actually have surgery that they've elected for because they're so worried about cancer spreading. So this is going
Mm,
to be tremendous information.
yeah, and
Any
just
final thoughts?
yeah, the
About it?
idea is ask your doctor. If ask the doctor if staying on fish oil is right for you. I mean, this should be an invitation to a doctor. And I'll tell you, my experience from practice is most doctors have never heard of this or don't know about it.
Mm.
If anybody wants to find me on Instagram, you can. It's my name, Jeff Crippen. I'll send you a link to these 3 studies so you can share with your doctor. And, you know, let them watch this presentation, send them a link to the studies, and if they're open to it, maybe you'll be able to help a lot more patients have a 19% lower risk
Mm.
of major bleeds, use, 16% less blood transfusions, and oh, by the way, have the anti-cancer the lower triglycerides, the optimizing cardiovascular function, optimizing brain function, lowering inflammation in the body, optimizing hormonal health, all the other effects that we know it's having, 35% lower risk of a heart attack, basically a cardiovascular event. Like all of that's what you're getting. If you have to stay off it for 3 to 7 days, as long as they don't give you any recommendations, eat some fish and do a sardine surrender in honor of Dustin. But have them because it's not the end of the world if you get off it for a week. But the point is, some of these researchers were given 2 grams a day on the morning of surgery, and surgery is usually early in the morning. So this is like wake up at 5, take your fish oil, and roll into the procedure. And they were seeing better outcomes. So this ought to be a tap on the shoulder for all of us to say, just because we heard it on the news or from our doctor doesn't mean it's true. And there's some good research behind it, and just encourage you to explore it and pass that on to your doctor as well.
Right. Yeah, so great. And this doesn't just go for fish oil, right? Any advice that you're hearing that doesn't ring true or doesn't make sense, question it. And if you need more backup, send it to us and we'll give you the backup. We'll figure it out.
Unless your doctor also told you to not eat McDonald's the morning before surgery and for 7 days before surgery.
And for 7 years after surgery.
Yeah, exactly. Have as much McDonald's as you want, but please don't eat fish. It's just, it's insanity.
Yeah. Dr.
Great
V,
presentation, Doc. No, I would just thank you, Dr. Crippen. That was awesome. Very well documented and researched. This information really needs to be out in the public, and so I hope we can. So share this, like and share.
Yeah.
Let's get the information out. Let's shorten that 17-year span of what it takes to change the narrative. Let's do what's better for us as a human population.
Awesome.
Yeah, and I'll send you both of you guys those studies so you can pass them on to your patients as
We'll
well.
put the links in the description for everybody, so please do. Yeah,
Perfect.
Awesome.
Well, everybody, thank you for your time, guys. Thank you for watching, everybody. Next week, Dr. V and I are going to dive deeper into longevity. We're going to look at some things that have been consistent in super centenarians and help you understand why we think that might be worth examining deeper. We'll see you guys in the next one. Thanks for watching.